This week, as we marked 1 year since the pandemic was declared, it's no secret that nursing homes got it the worst. A mixture of older residents and limited space created a perfect hunting ground for the deadliest pandemic in more than 100 years. It was especially bad in the beginning, but now 1 year in, the question is, have nursing homes made any real changes or any attempts to improve after the crisis? We set out to investigate.
She hated it. The first week she hated it there. The food, the staff members, she said they weren't nice to the patients.
Last October, after a fall inside their home, Don Eshelman's wife, Sue, was sent to the hospital with a broken ankle. With Don working overnights and unable to care for Sue around the clock, the couple decided the best option was for her to do her rehab work at the Gardens at Stevens, a nursing home in rural Pennsylvania.
And how'd you meet?
We met on American Online.
Really?
Yes, a chat room.
Don and Sue were married in 2001. At the time of her fall, Sue, at 69, was fighting kidney cancer and diabetes, but Don says both were under control. The plan was for her to return home in time for Thanksgiving. But not long after she arrived, 7 months after the pandemic first began, the coronavirus swept through the Gardens at Stevens. Sue, along with about 80% of the other residents at the home, tested positive. She was eventually sent to the hospital.
Wednesday, they called me. Now, this is a Wednesday before Thanksgiving. They had called me and told me that they had to put her on a ventilator.
On the morning of December 2nd, Don says he got a call saying Sue should go to hospice. He got a second call that night.
A physician taking care of her called me around 6, 7 o'clock at night and told me that she's not even going to make it to hospice. What do I want to do? Make her as comfortable as possible. I don't want her to feel any pain. 10:30, I get a phone call from the hospital telling me that she had passed.
Sue was one of 39 patients who died from that outbreak, 2/3 of the residents at the nursing home. Don Eshelman has now begun legal action against the Gardens at Stevens. He wants to know why they weren't better prepared for a second wave.
Was it neglect on their part? Were they short-staffed? I don't know. Were they having their employees come to work sick and working? I don't know.
The home hasn't responded to you at all?
No. They sent me a card telling me how sorry they were for my loss.
1 year in now to the worst pandemic in a century. Have nursing homes made significant improvements?
No.
Matt Yarnell is president of SEIU Pennsylvania, the union representing healthcare workers across the Commonwealth.
We've had a decades-old problem in Pennsylvania nursing homes and nursing homes around our country, but I think, given the COVID, crisis, it lay bare, really decades of problems in the industry.
What's the biggest problem?
I would say the lack of staff.
Currently, nursing homes in Pennsylvania are required to devote 2.7 hours of personal care to each patient in a 24-hour period, a number that hasn't changed since the 1990s, even as the population has aged.
Less than 3 hours of care for somebody who's oftentimes totally dependent, so they need bathed, fed, changed, toileted, you name it. Everything that we do every day to, sort of have basic activities of daily living, folks need those supports, and trying to figure out how to do that with, in 2.7 hours of care in a 24-hour period is not very much at all.
Yarnell wants the amount of required daily care to move from 2.7 to 4.1. One obstacle, more staff to make that happen means more costs. 68% of the nursing homes in the U.S. are for profit. Lower staffing levels mean higher profits for investors. And that may have contributed to the high levels of deaths in U.S. nursing homes from the COVID crisis. Several recent studies have found that low staffing levels were linked to large outbreaks in individual nursing homes. Another issue, accountability. Who actually owns the nursing homes and how's the money spent? Most of it taxpayer funded. Owners listed in public records for the Gardens at Stevens are connected to a total of over 200 other nursing homes. including the one Stanley Dawson just retired from.
You know, once you get used to one set of management, and next thing you know, they make enough money where, you know, they get out of the game and they pass it on to the next management company.
Dawson worked in nursing homes for more than 30 years. At his last one, Care Pavilion, he says ownership passed from one group to another 3 times in 16 years.
When the homes got sold, did the care ever get any better?
Nah, the best time I can remember from my years of working there was when I first started. That was 2004. The company that was running everything at that time was a nonprofit. The ones that came behind them became profit-making companies.
Did you get the sense that owners cared about the workers?
No.
Did you get the sense that the owners cared about the residents?
Somewhat. You know, not like they should, somewhat.
You've got 60 beds in your current facility. How many nursing assistants?
The ratio for 60, about 3.
How much time does that allow you to spend with patients individually on a daily basis?
Very, very little.
Julie Moore has been a nursing assistant for more than 20 years. She works at the same nursing home in Philadelphia that Dawson did and met us before a recent shift.
Why wouldn't they hire more people?
They've hired people, but they still don't staff the floors correctly. And when we go to management about it, the reason is their budget, their over budget is the reason that we're getting.
Are you scared to speak out?
No, not at all.
Not worried about your job?
No.
Why is it so important for you to do this?
Because it's just not fair.
The industry left to itself to correct itself is not going to work.
Ultimately, you're talking about money.
Yes, but with clear outcomes that we're going to invest in making sure there are enough people to do the job and do it well. So getting to a minimum staffing level across this country that is humane.
Many people already struggle big time trying to pay for care for their parents who are in nursing homes. You're asking them to pay more now.
I'm not advocating for blank checks. I'm advocating for minimum standards that are really built around care, and also transparency on where the dollars go, so we actually know what we're paying for.
Have you been given any kind of timeline?
Don Eshelman has been asking to see his wife's records from the gardens at Stevens for 3 months. So far, to no avail.
What answers do you want from the home?
I want to know why. I mean, it's not been, the pandemic just didn't start in November. This pandemic started back in March.
Do you think you'll get those answers?
I'm hoping I get them answers. That's all I'm asking for is what happened. How did 39 families lose their loved ones? So there's 38 other families out there probably wondering the same thing I'm wondering. What happened?
We reached out to the gardens at Stevens and Care Pavilion multiple times for comment, as well as the owners Don Eshelman is seeking damages from. They did not have a comment. And what does more staffing means? It means that there's more people to do procedures the right way. It also means the workers aren't rushed and overworked and can pay more attention to the patients.
It seems like when that profit model is first, that's where people start to suffer. And if they haven't learned, whether it's a pandemic or something else, there has to be better care.
I think we're going to learn a lot more in the coming years as we look at what happened over the past year.